So I arrived on scene here. I've ensured that the scene is safe and there's no significant dangers to myself, my patient, or myself, my partner, or the patient themselves. I've got the appropriate PPE on, which is safety glasses and gloves, so standard precautions are taken. I've come in, identified the patient, going to ABPU, and identified that the patient is alert. We did my primary service at ABC. So, hi there, mate. My name's Reese. I'm from the ambulance service. What's your name?
Matt.
Matt? Okay, no worries, Matt. You called us here because you've got a bit of chest pain, is that correct?
Yes, it is.
That is correct, alright. So, in the instance of this scenario, I'm going to conduct a 12-lead ECG. So I'm going to explain to the patient the procedure and what it entails, and also gain consent from the patient. So, Matt, what I'm going to do is, I'm just going to place a few electrodes on your body here. What that's going to allow me to do is have a better look at your heart, ensure there's no significant arrhythmias or any problems with your heart. Are you okay with that?
Yeah.
Okay, great. Now that's just going to involve me placing a few stickers on your chest, on your arms and your legs. It's non-invasive, it doesn't hurt. Any of the wires, they can't electrocute or anything like that. Are you okay with that?
That's okay.
Okay, great. So to maintain patient modesty, and we are on a job site right now, so what we're going to do is we're going to leave the shirt on, but for the purpose of the scenario, I'm just going to explain when the electrodes are placed as we go through. So I'm going to place an electrode on the right arm, left arm, right leg and left leg. Then we're going to go through our V's 1 to 6, so these are our chest leads here. So V1 is located in the fourth intercostal space to the right hand side of the sternum. So I'm going to start at the clavicle here, just in the medial aspect. So I'm going to start finding my first intercostal space, and then working my way down the intercostal spaces until I find the fourth intercostal space, and I'll place V1 electrode there. Now I know where the fourth intercostal space is. I'm going to go to the left hand side of the sternum, starting inferior to the clavicle, and work my way down the intercostal spaces. So 1, 2, 3, and 4. So just adjacent, bilaterally the side of the sternum, we've got leads V1 and 2. Now leads V1 and 2 look at the septal region of the heart. Then we're going to work to leads V4. So I'm going to go to the mid-clavicular line. I know where the fourth intercostal space is, so I'm just going to go inferior to that fifth intercostal space. Working for our mid-clavicular line down the chest, I'm going to place electrode V4 there, and electrode V3 goes in the middle between leads V and 2. So leads V3 and 4 are looking at the anterior aspect of the heart. We're going to place leads V5 in the anterior axillary line in the fifth intercostal space, and leads V6 in the fifth intercostal space next to leads V5 in the mid-axillary line. Leads V5 and V6 look at the lateral aspects of the arm. So Matt, I've just placed these electrodes on here now. So now I'm having a look at our life path 15, looking at an ECG to gain a trace. So what I'm looking at an ECG trace is trying to identify any arrhythmias. I'm looking at the P wave, the PR interval, the QRS complex, the ST segment, and also keeping an eye on any STEMIs. So depending on any ST elevation or regression, I can also identify where that STEMI is located, and then that can also allow me to identify which coronary artery is included, whether it's a thrombosis or an embolism or anything like that. And that's good.